My name is LFinucane, and I will be sharing my expertise on what I learned from the journal, A Review of Nutrition and Dietary Interventions in Oncology. Cancer is the leading cause of death worldwide. In 2018, there was over 1.7 million people diagnosed and 600,000 deaths from cancer. Then in 1999 to 2015, cancer rates and mortality rates decreased due to the improvements in therapies and detection. Therapeutic effects in diet may cause for more improvements. The purpose of this journal was that there has been much interest in the last decade in the role of diet and its effects on cancer metabolism. The interventions that were used was that they looked at the different diets that are usually provided to cancer patients, and they gave the pros and cons of each diet. The different diets that were measured was the Western diet, calorie restriction, intermittent fasting, ketogenic diet, Mediterranean diet, Japanese diet, and the vegan or vegetarian diet. The summary of groups used for the different types of cancer to the different diets. They used breast cancer, prostate cancer, colorectal cancer, lung cancer, esophagus cancer, and even liver cancer. Each diet had their own different strengths, except the Western diet, which had no strength at all. Starting with caloric restriction, it had a reduction in oxidative stress, inflammation, and growth factors. Then there was improved insulin sensitivity and glucose tolerance, decreased the leptin level. It promoted autophagy, which is it promotes the tumor suppression during cancer initiation and protects the tumors during progression. Then it decreased angiogenesis, which is the process of tumor cells creating new blood vessels to support their growth and spread. Next, we had intermittent fasting, which improved the chemotherapy associated side effects, improved insulin sensitivity and glucose tolerance, and it decreased the growth factors. Next, this ketogenic diet, which increased ketosis, decreased inflammation and growth factors, that promoted the inhibition of tumorigenesis, which is the formation and development of tumors. It promoted the utilization of the Warburg effect, which is the process that provides rapid bursts of energy and is important to generate the building blocks needed for rapid cell growth and proliferation. And it was selective increase in oxidative stress in the cancer cells. Then there was diets such as Japanese diet, which always had a lower deaths from cancer and other chronic conditions, thought to stem from low intake of fats and oils, their low intake of the omega-6 unsaturated fats or PUFAs, always had a higher intake of vegetables and dietary fiber. There's also a higher intake of green tea, which has the polyphenols, and it also has higher intake of soy products. Then there was the vegan diet, which is higher in fiber, magnesium, folic acid, iron, and vitamin C and E. It had a low overall in calories and saturated fats. It is associated with a variety of health benefits and lower overall risk of cancer. Then there was the Mediterranean diet, which is a healthy diet to provide protection and lower the risk of cancer, but it's just a collection of food practices that are seen in a population near the Mediterranean Sea. The weaknesses that were considered in the diets were in caloric restriction, which had excessive weight loss, risk of cachexia, and risk of malnutrition. Intermittent fasting had the same, which was excessive weight loss, risk of cachexia, and risk of malnutrition. Ketogenic diet had weight loss, hyperglycemia, nausea, vomiting, lethargy, increase in serum cholesterol, and progressive bone loss. And then the Western diet, which is the lowest, had low nutritional density associated with prostate, breast, and colorectal cancer, and it's associated with chronic diseases. The Japanese diet has recognized that cancer has increased due to the Western diet in the Japanese culture. The authors have concluded that there are guidelines that state a cancer patient should have a nutrition screening and assessment to receive early dietary interventions to improve the outcome of their cancer. But they also do not feel that there has been anything innovative or clinically meaningful in the techniques when it comes to nutrition for cancer patients. Everything has been superficial when they look on the Cancer Society pages. Every page talks about nutrition is important, but they don't give any specifics. With my conclusion, when considering a dietary intervention for a client with cancer, it must be individualized and personalized. Then it must be approved by the oncologist, dietitian assigned, or anyone else that is a part of the client's team of doctors that are involved. I also agree with the American Cancer Society that nutrition is an important part of cancer treatment, and eating the right kinds of foods during and after treatment can help you feel better and stay stronger. Even though it's not a specific diet, that's where individualization and precision of a dietary intervention come into play.